I'm here with Professor Adrian Kupel, and we're here at St. Philip's College, and we're at the Center for Health Professions. And this is really impressive in here. What exactly is it?
This is our simulation lab here at St. Philip's College. What we have here is our nurses come in here and they actually practice and get their practical skills and some of that training before they go out into the real field and to be more comfortable when they're out there.
Yeah, it looks like to me it's very hands-on, very practical.
It is very hands-on. We utilize stuff that is real life that they actually utilize in the real base in hospitals. And so what they do here is take this and get that hands-on direct training with the mannequins and sometimes even with themselves and practicing. And then what they can do is take that and relay that out into the atmosphere.
Okay, could you explain exactly like what the practicing nurses, what they're doing?
Yes, we have one set of nurses. We have one that's actually what they call the nasogastric tube. So what they're doing is preparing to put in a nasogastric tube, also preparing to look like a bolus of fluids for the patient. We also have another nurse over here who's actually inserting what we call the intravenous catheter, IV, for the patient to get fluids. We have another nurses that are doing what we call Foley catheterization that would help a patient with urination. And then we have some doing assessments. With the assessment, she's doing blood pressure checks and also doing a full body head-to-toe assessment with cardiovascular.
All right, and I understand you have an ICU as well.
Yes, we have an ICU, which is our intensive care simulation, which is utilized for an immersive simulation area. So what that does is more adverse and more advanced, and where we actually use a 3M simulation mannequin that does real life. He speaks, he talks, he breathes, so it makes it really realistic for our patients and also for our students.
Yeah, I was about to say, it sounds really realistic. Okay, so you've got, tell us about the LVN/military to ADN program.
Okay. Our LVN military to ADN program, our nurses are already licensed vocational nurses. So what they do here, they actually come in, they take 7 prereqs, and it's a face-to-face course for 3 course semesters. And at the end, they will actually test the Texas Board of Nursing to get their registered nurses and have an associate's degree in nursing.
All right, and you also have a generic ADN?
Yes, our generic program is starting soon. That program there is for individuals who are not nurses. They still take the 7 prereqs. That will be an online, face-to-face, and hybrid courses, and it's weekends and evening program. And at the end, they will also end up with an associate's degree in nursing.
Hey, and if somebody's watching and they're like, I would like to do that, how can they find more information?
Sure, they can go to alamo.edu, and then they can put in the search bar nursing. And when they go to search bar nursing, they can look for our programs and choose which one they like, and they give them information on that. And also our program director, Dr. Valerie Moak, is also listed on there, and they can contact her directly.
Okay, well, thank you for your time, and thank you for allowing us to come up here. This is really interesting.
Thank you, and we appreciate it.